A solid understanding of the domain knowledge is necessary, but not a requisite to doing well, though. It goes without saying that the more knowledge a BA has of a domain, the more value they can add by asking the right questions. Welcome everyone, welcome to my channel. Today we will talk about claims process. In my last video, we talked about healthcare and healthcare insurance. So today we will talk about how this claim process works. Claims process. There are few steps are in claim process. Claim process flow, claim submission, adjudication process, encounter submission, and compliance check. So just an example. You have insurance, you set it up, you made a payment, you schedule your appointment, and you visit the doctor, and you have a copay. You paid that, fill up the documents, and then doctor checked you. We can call healthcare provider as well too. And then they submit the bill. And the insurance company will send you EOB, its eligibility of benefits, that how much doctor visit was, and you made this co-payment and how much you owed. If you owe more, then you have to make more payments. And then if the claim is going to be submit, and if things are not well, if it's not submit properly, it can be denied too. And sometimes if it's specialist services and your insurance don't cover that service, that claim can be denied as well too. So let's go with the flow, how this claim process works and denied at the same time. All right, let's talk about claims lifecycle. So there are three ways to submit the claim. Through EDI system, we call this electronic data interchange, where there is no human interaction. Basic edit will happen, check for omission, coding errors, all this, and then it will be submit to adjudication system. We call it facets too. And then if automatically, if it's going to say yes, everything is all set, claim is paid, and claims payment extract. But if there is denied, adjudication system is going to deny it, and then they will send it back the eligibility of benefits letter or something like this to the provider and the patient, that why this claim is being denied. And then through online records, if through web portal they are submitting the claim, then again the basic edits will happen. It's going to go through the adjudication system, and either it's going to be paid, denied, or pending. And once they're done with this part, if the claim is pending, if there is any error, or they are looking forward for more medical reports, maybe they're asking for x-rays, they're asking for more reports related to that, then it's going to be reviewed by analyst. Once it's done review by analyst, then either it's going to be denied or it's going to be paid, and here you go. So this is going to be the manual entry, where they write it, they submit the claim by paper, by mail, they submit it manually. What will go if it's passed, then again it's going to go to the adjudication system. If it's reject, then it will go back to the provider to fix the defects and all that if anything is missing. And if it's going to fixed again, the cycle is going to be scanned, the manual adjudication system is going to go through it, and then here you go, they will be either accept, denied, or paid. Let me show you another picture where it's a simple version of it. For example, this is a provider. It can be the hospital, it can be your clinic, it's going to be a nursing home, So they will submit the claim. This is a paper claim, and it's being received by US mail. Okay. This is the electronic claim. We were talking about the EDI system. Okay, electronic data interchange. You need to know this. The EDI system is electronic data interchange. No human interference happen in this system. And then the web portal claims, and then the correspondence received by US mail or something like that. So paper claims are imaged, scanned, data keyed in, claim will go through the adjudication system. What we call this? Facet. Remember, we talked about it. This is a software where it will go through, the claim is going to be accepted or denied and all that. And then it goes through the review by claim by analyst or auto adjudication. Okay, so EDI go through the same way. But if there is an error, then yes, it will go back to the provider again. But if there is no error, Facet is gonna be going through the adjudication system. If everything is all set, it will be, submitted, claim, denied, or how it will go. So this is our electronic claim via web portal. And this is the US mail. So they receive the mail, it will be scanned, data keyed in, there's another system, MSS, but most of the time Facet is used for electronic claims and all that. And then everything will go through that and it will turn the manual claims into the review by claim analyst or auto adjudicated system. And then this claim portal, the same thing will happen, the mail via mail claims or via paper claims, these they have to go through the claimed image, they have to scan them and all that. But if it's from web portal, it's going to go straight to data keyed in and then MSS system, which is the software, and then review by claim analyst or auto adjudicated. I know it's a little complicated cycle, but this is how this claim processing workflow happen. And through the system, you need to know it as a business analyst how this claim processes work. So elements of claim, there are few important elements you need to know. Member information, definitely. Members, when you visit the doctor, if you're visiting them first time, you need to write it on your social security, your name, your last name, your date of birth, and if you have any other allergies, if you have past surgeries, everything, it needs to be there. The provider information, their tax ID number, their their medical number, their clinic number, and there are a few other things they need to submit it before they submit the claims and all that. Other health insurances, we call it, or coordination of benefits. These two are interlinked together. If there is any accident or employer benefits are in there. So, OHI, we call this. We will talk in detail how this works. Then, there are some procedure codes there. If there is any procedure happen with the patient, then there is specific codes related to that. Diagnosis code, if a healthcare provider diagnosed something, so there's proper diagnosis code. So when they submit the claims, they put that code in there. And there's different code for claims and billing, but always remember that ICD-9 and ICD-10 with WHO, International Classification of Disease by WHO, that list all diseases known to man and assign code to it. So ICD-9 is an older version, ICD-10 is a newer version now. Claims are generally broken down into two main categories: claim from physician, claim from facilities. So physicians call medical claim or professional claims, facilities called as institutional or hospital claims. So we already talked about the member information. A claim always shows information about the member to whom the provider rendered services. The information about the member include the member name, address, date of birth, ID number, social security if you're in US, provider information, we talked about it, their state provider ID, tax identification number, their address are included. There may be information about another provider, such as referring provider. Sometime if you are visiting your family practitioner and all that, and they referred you to the specialist, so when they refer it, they need to put up the reference number as well too. Okay, let's talk about coordination of benefits and other health insurance. If a member has OHI on the claim, The coordination of benefits is also required. For example, if the treatment rendered was in relation to a motor vehicle accident as a part of worker compensation claim, then OHI, other health insurances, filled in. Coordination of benefits is a way to coordinate all of your benefits and when you have dual coverage. Okay? Let's talk about now procedure codes. Procedure codes are defined what services have been performed. Okay, so if you are visiting your specialist, if you have to go through a surgery or procedure, that define what services have been performed on medical claims. There are also called current procedural CPT codes. Okay, procedure codes give a precise description, and this is very important for the claims. Type of service performed, they're also the mechanism by which the exact level of reimbursement is determined. Hospital claim procedure codes are called as HCPC. What do we call this? Okay, let me erase this. What do we call this? HCPC, Hospital Claim Procedure Codes. Well, CPT codes that are published and copyrighted by AMA, this 5-digit system describes procedures, service providers, and may render to their patient. Like CPT code 99213 indicate office visit, CPT code 56300 indicate a laparoscopy. Now let's talk about the level 2. Contain HCPCS, Healthcare Common Procedures Coding System. There are also 5 digits. They are also 5 digits code, but they begin with an alphabetical character between A and V. So that's how you can identify it with the exception of S. Example, HCPCS, Healthcare Common Procedure Coding System, code A4 253 indicates glucose strips, test strips. HCPCS code E0570 indicates nebulizer. So HCPCS codes are number assigned to every task and service a medical practitioner may provide to a Medicare patient, including medical, surgical, and diagnostic service. Okay, so since everyone uses the same codes to mean the same thing, they ensure uniformity, and this is very important because that's how the software for adjudication system is set up too. So this is how it's easy for process the codes and all that. Let's talk about diagnosis code. So diagnosis code describe the patient condition or the reason the service were performed. Although no dollar amount are attributed to ICD-9 and ICD-10 codes, which is International Classification of Disease, they do indicate medical necessity of a particular service. So diagnosis code V20.2, routine infant or child health check. Okay, so diagnosis code 650, delivery in a normal complete case. So these are the normal version of diagnosis code. Taxonomy codes, we call them specialty codes as well too, and they are 9 digits number assigned under the HIPAA. What is HIPAA? Health Insurance Portability and Accountability Act. You need to know this. HIPAA, if you're working in claims and insurance and all that, Health Insurance Portability Accountability Act, HIPAA is gonna play a vital role around you. So HIPAA provision to healthcare provider in order to digitally encode their specialty in order to facilitate electronic billing. So in home health agencies, these are the codes over there. Adult Day Health, these are the codes, and Hospital Journal, they have these codes. So few codes you have to memorize so you know that, what are these codes are for. Either they are taxonomy code, diagnosis code, and they are procedure codes. There are few important codes. So for the location too, they use it like for for office it's 11 and home 12, urgent care 20, inpatient hospital, outpatient hospital 21, 22, hospital emergencies room is 23. Well, location code indicate where the service was rendered. So some commonly used location codes are these ones. So these are the basic one: office, home, urgent care, emergency room, outpatient, inpatient. So, these are little basic ones. Modifiers. Modifiers indicate that some specific circumstances has altered a service. For example, a procedure performed but has not changed the definition or code. If you are done with a surgery, but you need more surgeries related to that, things are not getting better, they have to proceed further for that surgery, and they indicate the procedure deserves, but a modifier may indicate the procedure deserve a payment at the full fee schedule amount, or that there was less work than the individual in the CPT code description. Then the modifiers happens, like multiple procedure code is 51, repeat procedure by the same physician, repeat procedure by another physician, assistant surgeon when qualified resident is not available. So these are code modifiers are existed. These are the modifier codes, and they show that either the repeat procedure are done by the same physician, or repeat procedure by another physician is done, and the multiple procedure are needed, and if assistant surgeon did that procedure, well, the qualified was not available. So they have these codes as. Let's talk about type of claims. So there are CMS 1500, there are two types, and UB04. We also call UB04 is 1450, CMS 1450. So CMS 1500 is for professional medical claims, and it can be for Medicare, Medicaid, and UB04 involve admission to healthcare facility, and it can be private insurance and other insurances. Both of these claims forms are developed and approved by CMS. So the Center for Medicare and Medicaid Services is a branch of the U.S. Department of Health and Human Services, HHS, and CMS is the federal agency that administers the Medicare program and monitors the Medicaid program offered by each state. So CMS 1500 were formerly blank HCFA 1500 forms, and UB04 insurance claim. They are all red, by the way. Forms are also called CMS 1450, and later time they used to call it UB92. Professional claim type. So although there are a variety of medical services, the charges that appears on any given claim usually revolve around the particular type of treatment or provider. So as a result, claims are categorized into types, which will often affect adjudication. So primary care physician, specialist claim, emergency, OB, gyne claim, newborn, radiology, lab claims, surgery claims, anesthesia claim, home healthcare claims, durable medical equipment claims, transportation claims. So, these are all the professional claim types. And what about the facility type? So, it can be primary care physician claim. In this case, the bill comes from a clinic. Okay, emergency room claim, OB/GYN claim, newborn well child claim, radiology lab claims, surgery claims, multiple surgery claim, and home health care claim. So they are general claims types encountered in UB04 claim form. Each of these types also appear on CMS 1500 claim form when billed by the physician. There are some important rule for claim submission, and sometimes a little mistake, they have to go through declined claims and error, and then they will send it back to the provider, and the person will be waiting for the and the clinics or the hospital or the providers will be waiting for the reimbursement and all that. So provider must follow the state and insurance company guidelines when submitting claims. Below are the general ones. Are electronic and paper claim must have correct Medicaid ID number or they will be rejected. Electronic and paper claim have correct NPI number. We already talked about NPI number, and in our last video in taxonomy code, in appropriate field. We talked about taxonomy code right now, and otherwise the claim may be delayed. The provider has specific amount of time from the date of service to submit a claim for that service. This limit may be different if the provider participates in the network. Typed or computer printed paper claim are never accepted if the info is marked through or while out was used to manually alter the claim. It will be denied as well. Handwritten paper claim will be rejected and returned to the provider. So remember that for the claim submission, these are very important and vital rules. There are a few more rules, like following are some of the reasons why the claims get denied or paid less amount. Claims has missing information or was submitted with the incorrect information of the member, patient, healthcare provider. Provider did not bill according to their contract. Provider did not obtain an authorization. We will talk about authorization. What is that? Member was not enrolled on the date of service. Sometimes your insurance is going to kick in, for example, in the next month, and the patient came for a visit before earlier than that, then the insurance is not going to cover you with that. So member has OHI, the provider was not aware of. So these all things is going to create either a denial or you're going to get a less amount. So let's talk about adjudicated claims. Means that claim is processed through facets can auto adjudicate claim that successfully pass through system configured edits. Claims that do not pass successfully are manually edited and adjusted by the claim analyst. Okay, so this is called adjudicated claim. Awaiting batch. A fully processed claim awaiting disbursement of funds during the next provider check run. Clean claims. A claim received from the provider with no correction necessary. Adjusted claim. Claims that are corrected due to the error. Remember we talked about in our life cycle, claim life cycle, such as incorrect member number, incorrect provider number, or overpayment. Corrected claims. A claim resubmitted by the provider with the corrected information. And then when a provider sends a claim with missing info, for instance, the claim is returned to the provider resubmits the corrected claim. So these are some corrected claim, adjusted claim, clean claim, awaiting badge, adjudicated claim. Authorization. A request by a provider to treat a member. So when you schedule your appointment, they ask you for your policy number, group number, they call your insurance company, and they are, if you are enrolled and this thing is covered. If it's not and you are visiting, they will let you know that this is going to be your payment and this is your insurance company is paying you. So this authorization is really important, before they will check any patient and all that. So, in a facet system, we already talked about the adjudication, automatically adjudication happen, and then there are some status code for each status description. If it's accepted, awaiting batch, the code is 01. 02 is for accepted batch, which is complete. 10 is logged awaiting process. 11 is for pending awaiting batch. 91 is adjusted processed. 92 adjusted pre-priced. 93 closed pre-price now paid. 99 it's closed. So this is how the facets claim status codes looks like in facets. You need to know that. So at the last, let's talk about what is the authorization and utilization. We already go through our claim, CMS 1500, UB04, facet system, our claim life cycle, claim flow, how it needs to be submitted, what are the denials, and what is the facet system, how the adjudication system process, how The authorization is important for the provider. So let's talk about the authorization process. So the clinical staff of the insurance companies, nurses, social worker, pharmacy technician, and pre-authorization assistant manage medical care by reviewing requests for future medical service from providers. So a provider must submit requests to perform certain services. When a request is granted by the insurance carrier, it is called authorization. Some service, however, require the use of medical necessity criteria and must be pre-authorized before a provider perform the service. Some service do not require pre-authorization but do require the provider to notify the insurance company when they are going to provide the service to the member. So when the request of pre-authorization has been reviewed by the medical management and found to be medically necessary, then this review process is called utilization management. So that's all with the claim process as well too. So we covered the healthcare domain with our claim process, healthcare, health insurance. As an entry-level business analyst, that's all. It's more than enough information for you. So once you are employed as an entry-level business analyst, make sure to gain knowledge in different projects. So in future, you will be able to specialize in the domain or business you are notably fascinated by. But there are few skills always remember needed in the business analyst role. It's your communication skills, your critical thinking, your business knowledge, problem solving skills, technical skills, and think like a business user, act like a business user, and don't worry, you will do good. Take care. Thank you for watching. Please subscribe and like my channel and have a great day. Bye bye.